So sleep paralysis is where somebody would wake up from sleep and be unable to move, although they would be completely conscious. For most people, it is just a one-off phenomenon and it doesn't happen again ever in their lifetime. But you do get some people where it happens frequently, although it is rare. Obviously, if it's happening frequently, then it will cause a lot of fear and frustration. And even for the people where it happens as a one-off, it can cause panic because they think they may have had a stroke or something like that. And as a result, you can get sort of various mental health problems, anxiety, depression, and that can affect their health. There's not really any tips to reduce the possibility of getting it. It's one of those issues that either happens or it doesn't. And in terms of sort of what you can do about it, it is worth, if it is happening recurrently, seeing a doctor to be referred to a specialist who can sometimes help to reduce the frequency of the sleep paralysis, and also look for reasons behind why it might be happening.
First question was, what is sleep paralysis? So I guess the easiest way to explain that in layman's terms is where it happens in REM sleep, and pretty much the brain wakes up, but the muscles are still asleep. So you can't move, but your brain is going. So there are oftentimes hallucinations and whatnot. So when was your first sleep paralysis? About 42 years ago, so I was about 15. What were you thinking? Probably the very first time it happened, I thought of it as just a very bad dream. And then as it continued over years, then without any real education about it and nobody really doing any studies about it, I think I felt the same way a lot of people did, was we kind of felt like it was some kind of demonic thing. But, thank God for the internet and people who did research.
When was like the last time you had it?
That would have been probably about March of this year.
What normally happens when you have it?
So, for me, and it's different for everybody has different hallucinations. Some people actually have good hallucinations, but the majority have bad. For me, usually when it's first coming on, I know it's starting to happen because it sounds like I'm being sent down a flume of water. It sounds like rushing water going past my head. And then that kind of subsides, and multiple things have happened. Usually for me it's some kind of another being, and I haven't really determined. It's like I said earlier, it's almost like little demons or whatnot, whether they are just trying to attack, or sometimes I actually even hallucinate that I'm up out of the bed and trying to get away. It's hard to explain because it's a little bit different every time.
Okay, what was your scariest moment during sleep paralysis?
Probably the last time when I did hallucinate that I had gotten up out of the bed, and it was as silly as it sounds, this horrible little impish type of demon. And I was running. My daughter had actually come and was spending the weekend, and she was at the other end of the house in the other bedroom, and in my hallucination I was running toward her, and this thing was grabbing me by the legs. And that was pretty frightening.
Okay. What do you think sleep paralysis, like, what do you think could cause it?
Through research, what they've determined is that It's definitely an active brain, that's for sure. Different things that you do or shouldn't do before you go to sleep. The number one thing that has been found in common is it happens when you fall asleep on your back. And then they have also determined that, like, reading, caffeine, there are a lot of different factors like that kind of go along with it. For me, I think it's really falling asleep on my back is the biggest for me. So I make sure I don't do that.
You said that some people have good sleep paralysis. Have you ever had a good experience during sleep paralysis?
No, never.
Okay, is there...
And the other thing that I do that, might sound crazy is I have my little prayers that I say as I go to sleep. And I think that psychologically helps. And I think everybody has their own little safety net. And I think where you are in your head at the time you go to sleep, meaning if you're stressed, it's more apt to happen.
Do you think sleep paralysis is like a spiritual thing or just your brain messing?
No, I think it's absolutely, for years and years and years, yes, I thought it was a spiritual thing. Since there is research, since there is knowledge, I've pulled away from that thought process and realized that it is more physiological than anything else. But I do believe that the brain is very powerful and that we can create almost anything in our minds. So therefore, when I say if I'm having a rough period of time where it's happening more often than not, the little prayers, not necessarily do they work because it's a spiritual thing, they work because the brain is powerful and I believe they will.
Melatonin is a hormone produced by the pineal gland in the brain. It's responsible for setting the sleep-wake cycle in a human, so that when it's being produced, it will make them sleepy and they'll be able to go to sleep. And it tends to be produced as a result of the light fading and it going dark. It takes a while to become sort of established in newborn babies, but once it is established, it just carries on, and the hormone is produced regularly every day. It's also used in the medical profession to help treat certain sleep disorders, and is given as a drug. In the USA, it's available just over the counter in pharmacies, but in the UK, it is a specialist only drug. So as a GP, I never get involved in prescribing it or managing a patient's condition. In terms of how it affects patients, there's a lot of controversy about whether it is helpful in certain sleep disorders, although it is used for them. It certainly is very helpful to treat jet lag, where it's used quite frequently, and also in shift workers who are sleeping during the day when it's light, so their usual melatonin levels wouldn't be produced. In terms of the sleep paralysis that I mentioned before, it can actually make that worse. So obviously it's not a drug you would use to treat that condition. In terms of seeking help for any sleeping issue, a trip to the GP would be your first port of call, and although your GP wouldn't necessarily be able to help themselves, with the exception of treating insomnia, they would be able to refer you to a specialist who would be able to prescribe the melatonin and also manage any other sleep disorders that might arise. In terms of self-help, there are various self-help books you can get hold of. There are websites set up by charities who can help give general advice about sleep disorders, but it's in terms of treatment, it's mainly a specialist area where a consultant at a hospital would treat you.
Hello, I am mum to Thomas. Thomas has a rare chromosome disorder called 1q21.1q21.2. Tom takes melatonin at night. He takes 7.5 milligrams of melatonin. The purpose of the melatonin is to help him get to sleep, but it doesn't keep him asleep. Before the melatonin, Tom didn't sleep really at all. Even as a very young baby, he would have 20-minute cat naps, but would be awake. We wondered recently if the melatonin wasn't working properly, and what would happen if we reduced the dose. And Tom managed to stay awake for approximately about 48 hours, so it's still quite needed. So the effects on us are that we are permanently exhausted as parents. We are very aware that Tom's waking at night will wake his older brothers, so we try our best to contain it. I've not slept properly for about 2,115 nights and counting. There doesn't seem to be any end to it at the moment. I currently work 29 hours a week. I was trained to become a health visitor. Being exhausted, that went by the way, and just generally working is really difficult when you are so tired. As I say, I'm about to give up work, and I'm going to concentrate on other avenues where I can fit the work around Thomas. We are really aware that he wakes his older brother Alfie, and he would potentially wake his older brother Jack. So we are having renovations done to the house so Thomas can have his own bedroom, to reduce the likelihood if he doesn't sleep and he shares a room, he will wake his brothers, and that will disrupt their education, and further disrupt family life. So when people ask me what's the way forward from this, I really don't know. I guess that Thomas would continue to take melatonin, potentially take another medication to help him with sleep. We're not sure whether the rare chromosome disorder causes the sleep problem or the sleep disorder, or whether the sleep disorder is a result of a social communication difficulty. We just hope that things will improve and that it won't continue to impact on our personal and family lives.